All right, let's dive into something pretty important today.
Sounds good.
We're going to be looking at how culture shapes trauma.
Oh, yeah, that's a big one.
It is, and it's something that we often overlook,
Right.
but it's so crucial when we're talking about trauma-informed care.
Yeah, it really is.
And we've got a lot of great sources to dig into today.
Okay, great.
We've got articles on cultural competency,
Uh-huh.
guidelines for trauma-informed care,
Right.
some research excerpts,
Awesome.
and even some data from the National Child Traumatic Stress Network.
The NCTSN.
Yeah, the NCTSN for short.
I'm excited to see what they have to say.
Me too. So what's really interesting about this
Okay.
is that we're not just talking about surface-level cultural differences like language or customs.
No, you see.
We're going deeper. We're
What?
talking about how deeply culture is intertwined with someone's entire understanding of trauma.
Uh-huh.
It shapes how they see the event, their coping mechanisms, their support systems,
Oh, wow, yeah.
and even their healing process.
You know, that's a really good point.
And it makes you think.
What?
It's like trying to understand someone's pain through a completely different lens.
Yeah.
You know, a lens that's different from your own.
Yeah.
And when you do that,
You could miss things.
you might miss vital clues
Uh-huh.
or even misinterpret their reactions entirely.
Absolutely.
And that's why cultural competence is so important.
Yeah, I agree.
When we're talking about trauma,
Non-negotiable.
it really is.
You know, it's not just about knowing those basic facts about somebody's culture.
Yeah.
It's about recognizing the ways
Right.
that their culture shapes their understanding of the world, their relationships, their own healing process.
Absolutely.
So let's actually define these terms.
Okay.
Cultural competency, trauma-informed care.
Yeah, good idea.
What do those really mean?
So let's start with cultural competency.
Okay.
You know, I think a lot of people might assume it's just about speaking the same language.
Right. Yeah,
But it goes way deeper than that, doesn't it?
it really does.
So tell me more about that.
Cultural competency in healthcare, it's not just about language.
Uh,
It's about understanding and integrating cultural factors into everything we do.
Oh.
How we communicate, how we assess needs, how we develop treatment plans.
So it's not just about knowing what holidays somebody celebrates.
Well,
It's about understanding how their cultural background might influence their beliefs about health,
absolutely.
about illness, healing,
Uh-huh.
even how they express their emotions.
Exactly.
Like, give me an example of that.
Imagine someone who comes from a culture that's very stoic,
Okay.
that avoids outward displays of emotion.
Right.
They might downplay their symptoms
Oh, I see.
or hesitate to discuss emotional pain.
Interesting.
And a provider who's not culturally sensitive
Yeah.
might misinterpret that
How so?
as a lack of severity
Oh.
or
oh,
even a lack of cooperation.
Wow. That's a good example.
Yeah.
If something that's intended as a sign of strength in one culture could be a red flag in another.
Totally.
Yeah.
And on the flip side, someone from a culture that's more expressive,
Yeah.
they might be perceived as overreacting
Right.
or dramatic
Interesting.
when they're really just expressing their distress
In a way that's normal for them.
in a culturally appropriate way. Yeah.
Yeah, so cultural competence is about understanding those nuances
Absolutely.
and approaching each person with like genuine curiosity
Totally.
and respect.
Yeah.
So now let's talk about trauma-informed care.
Okay.
What makes that different from just regular care?
Trauma-informed care, it really acknowledges the widespread impact of trauma
Okay.
and understands the potential paths for recovery.
So it's not just saying, okay, this person has been through something traumatic.
Right.
Let's treat the symptom.
It's a different way of thinking.
It's saying trauma is prevalent
Yes.
and we need to shift the way we provide care
Exactly.
to be sensitive to that.
Yeah.
And to recognize that someone's behavior might be a result of past trauma.
Yeah.
Okay, so what are the key principles of trauma-informed care?
There are 6 key principles that guide trauma-informed care.
Okay, let's hear them.
Safety,
Okay.
trustworthiness and transparency,
Mm-hmm.
peer support,
Okay.
collaboration and mutuality,
Got it.
empowerment, voice and choice,
Right.
and cultural, historical, and gender issues.
I'm noticing that last one
Yeah.
specifically calls out culture.
Uh-huh. It's important.
And these principles aren't just for mental health settings, are they?
No, not at all.
I can see them being relevant in a lot of different areas.
You're right.
Like schools,
Mhm.
healthcare facilities,
Yeah.
social work, even within families.
Right.
Like anywhere where people are interacting with others who have experienced
Yeah.
trauma.
Exactly.
So we've got these 2 big ideas.
Okay.
cultural competency and trauma-informed care.
Yeah.
And now
We're going to connect them?
we're going to see how they intersect, right?
That's right.
Particularly when we're talking about how trauma can impact people from different cultural backgrounds.
And to really illustrate this,
Okay.
we can look at some data from the National Child Traumatic Stress Network.
The NCTSN.
Or yeah, the NCTSN.
Okay, what do they have to say?
Their research shows that minority children are disproportionately affected by trauma.
So we're not just talking about individual experiences here.
No.
We're talking about a pattern
Yes.
of systemic disadvantage.
Exactly.
And this reminds me of something.
Right.
It reminds me of the disparities we see in access to healthcare,
Yeah.
where certain groups just face much greater barriers to getting care.
That's a great connection.
And it makes you wonder,
What?
how does this unequal burden of trauma affect how communities see healthcare systems?
That's such an important question.
Yeah.
Because if a community has been repeatedly let down by systems that aren't designed for them,
Yeah,
how likely are they to trust those systems when they need help?
that's a good point.
It can create this deep mistrust. And it makes it even harder to reach out for help when you need it the most.
It's like a vicious cycle.
It really is.
You know, if you've grown up seeing your community let down by systems over and over again,
Yeah.
systems that don't understand you,
Right.
how likely are you to trust those same systems when you're at your most vulnerable,
Exactly.
when you're seeking help for trauma?
It makes it so much harder.
It does.
And it's not just about the individual experience.
Okay.
It's about those historical and systemic factors
Okay.
that make certain groups more vulnerable in the first place.
And that's where the need for culturally competent,
Yeah.
trauma-informed care
It becomes critical.
really comes in.
We need to understand the historical context, the systemic barriers, the cultural nuances
Right.
that shape how people experience and respond to trauma.
Okay, so we've laid the groundwork.
Yes.
But let's get practical.
Okay, good idea.
What does this care actually look like?
Yeah, what are some concrete examples?
How can we actually provide culturally competent, trauma-informed care?
Well, let's start with communication.
Right.
We can't provide effective care if we can't understand each other.
Yeah.
And I'm not just talking about spoken language.
Okay.
I'm talking about the unspoken language of culture.
The nuances, the body language,
Exactly.
how people express themselves.
Yeah.
And I imagine language barriers come up a lot in healthcare,
Oh, they do.
which makes it harder to access care
Mm-hmm.
and to feel understood.
More than you might think.
Really?
According to Georgetown University's Health Policy Institute,
No.
nearly half of the 37 million adults in the U.S. who speak a language other than English,
Okay.
they don't speak it very well.
Wow, that's a lot of people.
It is a huge number.
And so what are some ways facilities can overcome those language barriers?
Oh, there's a lot.
Okay, let's hear them.
Well, interpreter services are essential,
Okay.
but it goes beyond that.
Like what?
We need multilingual staff,
Okay.
community health workers. Yeah. Who are familiar with the languages and cultures of the communities they serve.
Yeah.
These are all crucial pieces of the puzzle.
But cultural competence isn't just about language, is it?
No, it's not.
It's about understanding those deeper cultural beliefs that we talked about earlier, right?
Exactly.
Like, for example, how in some cultures it's taboo to talk about mental health openly,
Yeah, that's true.
or how some cultures have specific rituals
Uh-huh.
around death and dying.
Right.
And if we're not aware of those nuances,
Yeah, we can cause harm.
we risk misinterpreting people's reactions
Uh-huh.
or causing more harm.
Absolutely.
Can you give us some real-world examples of how those cultural differences play out in healthcare?
Sure, let's say someone comes from a culture where it's disrespectful to make direct eye contact with authority figures.
Interesting.
They might avoid looking at the doctor when they're talking,
Uh-huh.
which could be misinterpreted as disinterest or dishonesty.
That's fascinating.
Yeah, something that's perfectly normal in one culture
Yeah,
could be a red flag in another.
exactly.
Or think about how different cultures approach physical touch.
Oh, yeah, that's a good one.
In some cultures, it's common to hug or touch someone's arm to express concern.
Right.
But in other cultures, that could be seen as intrusive
Yeah.
or inappropriate.
And if a healthcare provider doesn't know that,
Yeah, they can easily misunderstand.
misinterpret the response. Yeah.
Exactly.
So it's about understanding the individual
Absolutely.
and their unique cultural background.
Yes.
And how that might be shaping their experience.
It's about layers.
That is
Layers of
like
complexity.
those Russian nesting dolls.
Exactly.
Yeah.
And that's why we can't just have a checklist of cultural facts.
Right.
We need genuine curiosity
Yeah, okay.
and a willingness to learn about their story
Right.
and the cultural context.
So their individual story
Yeah.
and how their culture fits into that. It sounds like this kind of individual care requires a pretty big shift in how healthcare systems operate.
Yeah. It does.
It's not just about changing individual behaviors, is it?
It's bigger than that.
It's about changing the entire culture of care.
Exactly. It's not just about training providers.
Right.
It's about creating a system that's built on trauma-informed care.
Okay.
We need to think about organizational culture.
Okay, what's that?
It's the values, the attitudes,
Uh-huh.
the practices that shape the environment.
So like the overall vibe of a place.
Yeah, exactly.
Whether it feels welcoming and safe or cold and impersonal.
Yes, think about it.
Okay.
If a facility's culture is all about efficiency,
Uh-huh.
getting people in and out quickly,
Yeah.
that's not going to feel welcoming to someone who's been through trauma.
Right, it would feel like another layer of trauma.
It would.
Being treated like a number instead of a person.
Exactly.
So how do we shift that organizational culture?
Well, staff training is essential,
Okay.
not just for clinicians. Everyone from receptionists to administrators
Huh?
should be trained on trauma and cultural competency.
So they understand how their actions can impact someone.
Yeah, how their interactions might impact someone who's experienced trauma.
So creating that environment really is a team effort.
Absolutely.
Everyone has to be on board.
Yeah, it's a team effort.
And I imagine involving patients is key too.
Oh, for sure.
They're the ones experiencing the care.
They are the experts.
Yeah.
Systems should actively seek feedback
Okay.
from the communities they serve.
So things like patient surveys,
Yeah.
focus groups,
Uh-huh.
community advisory boards.
Right. It's about building trust,
Yeah.
making people feel heard and respected.
So what about those situations where a provider doesn't have specific knowledge of a patient's cultural background?
Uh-huh.
Is there a way to still provide culturally sensitive care?
That's where generic cultural competence comes in.
Generic cultural competence.
Yeah.
What is that?
It's the idea that even when you don't have specific knowledge,
Okay.
you can still be sensitive
Okay.
and avoid imposing your own biases.
So it's about being aware of your own cultural lens and recognizing that your assumptions might not apply to everyone
Exactly.
and being humble
Yeah.
and asking questions.
Yes, and being open to learning from your patients.
So shifting from I know best
Yeah.
to let's learn together.
I love that.
I love that too.
It's a much better approach.
This all seems so important.
It is.
But I can imagine it can be challenging
Oh, yeah.
to implement in a busy healthcare setting
It's tough.
where time is limited.
It is.
But it's also essential, isn't it?
It is. We can't keep providing care that ignores culture.
Right. We can't just ignore the impact of culture.
Exactly.
We have to do better.
And we can.
And it sounds like doing better involves a multifaceted approach.
It does.
Training,
Yes.
system-wide changes,
Hmm.
open communication,
Right.
curiosity about our patient. Absolutely.
It's a big task,
It's huge.
but it's clearly necessary.
It is.
And the stakes are high.
Really high.
Because when we fail to provide that care,
Yeah, what
we
happened?
risk re-traumatizing people,
Uh-huh.
perpetuating health disparities, and
Right.
failing to provide the support that people need to heal.
Exactly. And we know.
And we know from the NCTSN data
Right.
that those failures,
Yeah.
they disproportionately impact minority communities.
Right. The communities who are already carrying a heavier burden,
Yes.
it's like adding insult to injury.
It is.
It's a cycle we need to break.
We do.
And it starts with recognizing the limitations
Okay.
of our current systems.
And being willing to do the work.
Yes, the hard work.
Yeah, to change them.
To transform them.
This all makes me think about the phrase, do no harm.
Oh, yeah, that's a big one in healthcare.
Yeah, we hear that a lot.
We do.
But it seems like sometimes,
Unintentionally.
unintentionally, we are doing harm.
By not considering culture, by not taking these cultural factors into account,
It makes you think, doesn't it?
it does.
We say do no harm,
Uh-huh.
but are we really living up to that?
If we're not considering culture.
If we're blind to how our own cultural assumptions can cause harm,
It's like we're perpetuating the trauma we're trying to treat.
almost like we're making it worse.
It's a blind spot,
It is.
and we can't afford to have it anymore.
No, we can't.
We need to move beyond that one-size-fits-all approach
Definitely.
and recognize that what works for one person
Yeah.
might not work for another.
Especially with something as complex as trauma.
Right. It's deeply personal.
Absolutely. It's about recognizing their humanity,
Okay.
approaching them with compassion, curiosity, and a willingness to learn.
I love that.
Yeah.
So how do we even begin to address this?
It feels huge.
It does feel like a massive undertaking,
It is.
especially given all the systemic
A
issues
nerve-rooted problem.
that contribute to these disparities.
Yeah.
So where do we even start?
Well, I think the first step is shifting our perspective,
Okay, I like that.
changing how we think.
Shifting our perspective. Tell me more.
Well, we need to start by changing how we think about trauma.
Okay.
We need to move away from seeing it as an individual problem
Mm-hmm.
and recognize that it's often rooted in systemic issues.
Like what?
Poverty, discrimination, lack of access to resources.
So those bigger social issues
Those are the root causes.
that create an environment where trauma is more likely
They create the conditions for trauma.
and make it harder to recover.
Exactly.
So it's not just about treating the symptoms. It's
Right.
about addressing those underlying social determinants of health.
The root causes.
Yeah, that contribute to trauma in the first place.
It's a public health issue.
It is.
How do we create communities that are safe, supportive, resilient?
Yeah, how do we address those systemic inequities
It's about recognizing that connection
between individual experiences?
and those social structures.
This is starting to feel less like a healthcare issue
What does it feel like?
and more like a social justice issue.
And that's exactly what it is.
It is.
Trauma and social justice are connected.
They are.
When we talk about trauma-informed care,
Uh,
we're talking about a more just and equitable society.
we are.
We need to dismantle those systems of oppression.
That's a powerful point.
It's not just about individual treatment.
It's about preventing trauma.
Creating a world where trauma is less likely.
Okay, so what about those of us who work directly with people who've experienced trauma?
Yeah, what can we do every day?
What can we do on a day-to-day basis to be culturally competent?
It all starts with self-awareness.
Wow. Yeah.
Being aware of our own biases and assumptions.
We all have them.
We do, and it's important to be conscious of how they affect us.
How they might affect our interactions.
Yeah, with our patients.
So taking that step back
Mm-hmm.
and asking ourselves, am I approaching this person with curiosity and respect?
Yes,
Or am I letting my biases cloud my judgment
that's the question.
and being willing to learn
Yeah.
from our patients?
Ask questions, be open.
Okay.
Don't assume you know what they need or how they're feeling.
Let them be the experts.
Exactly.
So putting aside the textbook
Uh-huh.
and really listening.
Listen to the person in front of you.
Yeah.
And remember, even within the same cultural group,
There's variation.
so much variation.
Every experience is unique.
It is. We need to honor that.
Yeah.
We can't rely on stereotypes.
We have to see the individual.
See each person as complex.
with their own story.
Their own unique story.
This all sounds challenging,
It is.
but also rewarding.
It is.
If we get this right,
Yeah, what could happen?
we can make a real difference.
In people's lives.
Yeah.
I could create communities and systems that are healing
Okay.
and transformative.
It's about changing the culture
It is.
from blame and shame
Uh-huh.
to understanding and support.
Exactly.
I love that.
Me too.
So what's the one takeaway you want our listener to have
Ooh, that's a tough one.
as they continue learning about this issue?
Okay, if I had to choose just one,
Yeah.
it would be this. Trauma is not a one-size-fits-all experience.
Okay.
It's shaped by our histories, our social context,
Right.
and most importantly, our cultures.
Our
To
culture.
truly support someone who's been through trauma,
Yeah.
we need to understand their story, their context, their culture.
Their culture.
We need to listen with open hearts and minds
Yeah.
and be willing to challenge our own assumptions.
Our own biases.
Our biases, yeah.
Because of that, we can't rely on generic approaches to care, right?
Right.
We have to meet people where they are,
Exactly.
understand their needs,
Yes.
and provide support that's tailored to their cultural background.
It's about individualization,
It is.
recognizing that each person has their own path to healing.
It makes me think about the resilience of the human spirit.
It's amazing.
Even in the face of terrible trauma,
Yeah.
people find ways to cope, to heal, to rebuild.
It's inspiring.
And that resilience,
Yeah, where does it come from?
it's often rooted in their cultures, in their communities,
Absolutely.
in their connection to something larger than themselves.
It's powerful.
And we need to celebrate that
We do.
instead of trying to erase it.
Yes, celebrate those strengths.
We need to recognize that culture can both wound and heal.
It's a double-edged sword.
It is.
It can be a source of strength and resilience,
Uh-huh.
but also pain and trauma.
And it's our job to understand both sides.
As providers, educators, advocates, humans,
Yeah, to understand both sides.
and to work towards a world where culture is a force for healing.
Not harm.
Not harm, exactly. You know, it's funny, this kind of reminds me of cultural humility,
Oh, interesting.
which is basically realizing that we don't know everything about other cultures
Right.
and being open to learning from others.
I like that, approaching every conversation
Yeah.
with a sense of humility and
Say
curiosity,
that, yeah.
knowing that we don't have all the answers.
Right, exactly.
And the best way to learn is to just listen.
Listen to the people we serve.
Yeah, it's like we're all students,
Yeah.
constantly learning and evolving.
It's a process.
It is.
So how do we approach this learning?
Yeah, how do we even begin?
I think it starts with looking at our own biases.
Okay.
We all have them,
We do.
whether we know it or not.
Yeah.
And those biases can really influence how we interact with people,
Especially people from different backgrounds.
especially them.
So how do we even uncover those biases?
That's a good question.
Seems like a tough thing to do.
It is tough, but
Yeah.
it's not impossible.
Yeah.
There are resources
Uh-huh.
that can help us understand our own cultural lenses and how
Yeah.
those shape what we see.
Our perceptions.
Yeah. And there are also training programs
Oh, interesting.
that focus on cultural humility
Yeah.
and unconscious bias.
Yeah, I can see how those would be helpful.
They are.
I imagine just taking some time to self-reflect is important too.
Self-reflection, so important.
Really looking at our own beliefs and asking, like, where did this come from?
Uh-huh.
How is this impacting me?
And how is it impacting the people around me?
Yeah,
Exactly.
it's about developing like a critical awareness of ourselves.
Yes.
And how we fit into the world.
And realizing our experiences are just a small piece of a much bigger picture.
Right. There are so many ways of seeing the world
So many ways of being.
and being open to those differences.
Absolutely.
It's about expanding our horizons, right?
Yes.
Recognizing the human experience
Yeah, it's rich and complex.
and knowing we can learn something from everyone,
Everywhere.
no matter their background or beliefs.
You got it.
Now, going back to the NCTSN data for a moment,
Yeah.
it really showed us how much trauma impacts minority communities.
It did. It was pretty stark.
They're experiencing trauma at higher rates,
Yes.
but also facing barriers to getting help.
More barriers, yes.
Like a double whammy.
It is. And it's heartbreaking.
It really is, and it's a systemic issue
It is.
that we have to address.
On multiple levels.
On multiple levels, okay.
We need to look at the root causes of this trauma.
Poverty, discrimination,
Violence.
violence.
We need safe communities,
Yeah.
supportive communities, resilient communities.
Right, and communities where everyone can access care.
Culturally competent, trauma-informed care.
Yes, it's a huge undertaking,
Huge.
but we can't just ignore it.
I can't.
So let's talk solutions.
Okay, I'd love to.
What are some concrete steps?
Yeah, what can we do?
What can we do to create a more just and equitable system?
Well, for starters, I think we got to invest in community-based services
Okay,
that are designed for diverse populations.
that makes sense.
They need to be accessible, affordable,
Uh-huh.
linguistically and culturally appropriate.
So meeting people where they are
Exactly.
and providing services designed for them.
Not a one-size-fits-all.
Yeah, not trying to squeeze everyone into the same box.
Nope, it doesn't work.
And it's about recognizing the expertise in those communities, right?
Yes, absolutely.
They often know what they need
Did you?
better than anyone.
Better than anyone.
So we should be empowering them to create solutions.
Yes, absolutely.
It's about shifting from a top-down approach
To a bottom-up approach.
to a bottom-up approach.
Yeah, and we got to collaborate.
Yeah.
Healthcare, education, social services.
Law enforcement, all work.
Working together.
It's about creating a comprehensive system
It really is.
that can address the needs of
Survivors of trauma, yeah.
This is a huge paradigm shift.
It's a big one.
We need to change how we think about trauma and healing.
Absolutely.
We need to move away from individualistic models
Yeah.
and embrace a holistic approach
A community-based approach.
that recognizes the social and cultural context.
The context is everything.
It really is.
We need to shift from fixing people
Okay.
to healing them.
Healing, yeah.
It's not about labeling people as broken.
Right.
It's about recognizing their resilience,
And supporting their journey.
their journey of healing.
It's about compassion,
Compassion, yes.
understanding,
Understand.
creating spaces where people feel safe,
Safe to share, safe to heal.
to share their stories,
Yes.
to seek help without being judged.
Without stigma.
And we need to remember that healing isn't linear.
It's not.
It's a journey
A journey with ups and downs.
with setbacks.
Yes.
But with the right support, people can heal
They can.
and go on to live meaningful lives.
Absolutely.
That's a good message.
A message of hope.
It is a message of hope.
Because sometimes we focus too much on the negative.
Yeah, the damage.
The damage.
We forget about the possibility of healing.
But it's always there.
It is.
And we need to create the conditions for healing.
Okay,
We need to provide resources.
resources.
Dismantle systems of oppression.
Support community.
Support communities, yes.
And believe in people.
Believe in resilience.
Yeah, believe in the resilience of the human spirit.
I love that.
This has been such a good conversation.
It has.
We've covered a lot.
So
But there's still more to explore.
always more.
What are some of the innovations you've seen?
In trauma-informed care.
Yeah, in culturally competent, trauma-informed care.
Ooh, great question.
What are people doing?
There's so much cool stuff happening. It's
Right.
hard to pick just a few.
Give me some examples.
But one thing I'm really excited about is traditional healing practices.
Oh, that's interesting.
Yeah, incorporating them into care.
Like what? What kind of practices?
Well, they're different in every culture,
Right.
but they often take a holistic approach.
Okay.
They look at the whole person,
Mind, body, spirit.
physical, emotional, spiritual, social well-being,
Yeah, all of it.
all of it.
So give me an example.
Some indigenous communities use drumming,
Okay.
singing,
Really?
storytelling, ceremony to process trauma and heal.
That makes so much sense.
Right.
Tapping into that ancient wisdom.
Ancient wisdom.
Cultures that have been healing for centuries.
Exactly.
And there's evidence that it works,
There is.
especially for people from those cultures.
Makes sense.
It's about honoring their traditions, their beliefs.
Your ways of knowing.
It's acknowledging that Western medicine isn't the only way.
It's not the only way.
There are many paths to healing.
So many paths.
And healing is often a communal process.
It is.
It's not just about the individual.
It's about connection.
Yeah.
Support, belonging.
So we're weaving together the best of both worlds.
I love that.
The wisdom of tradition
Yes.
and the insights of modern science
Beautiful.
to create something truly holistic.
Holistic and culturally responsive.
What about technology?
Ooh, good one.
What role does technology play in all of this?
I think technology can be a powerful tool.
Okay, how so?
For example, telehealth
Oh, yeah.
makes it easier for people in rural areas to access care.
Right. It breaks down those geographical barriers.
Exactly.
And there are apps now,
there are.
online resources
Yes.
that can provide culturally tailored support.
They can.
So we can reach more people,
We can.
especially people who might not have access to traditional services.
Exactly.
But we have to be mindful of the digital divide, right?
Absolutely.
Not everyone has access to technology.
Right. We don't want to create more inequities.
Yeah, we don't want to make things worse.
You got to be mindful.
So it's about using technology to bridge those gaps.
That's bridge gaps, not widen them.
And remembering that technology is just a tool.
It's a means to an end.
It's not a magic solution.
It's not.
We have to use it wisely
Wisely and ethically.
to create a better system.
A more just system.
Yeah, so it seems like there's no easy answer
There isn't.
to this issue of trauma and healing.
No easy answer.
It's complex.
It is.
It's multifaceted.
It's a journey.
And it requires us to challenge our assumptions
Always be questioning.
and to embrace new ways of thinking
New ways of being.
and being.
It's a journey we take together
I love that.
with humility, compassion,
And a commitment to justice.
social justice.
It's about recognizing that we're all in this together.
We are.
We all have a role to play
We do.
in creating a world where everyone can heal
Everyone.
and thrive.
I love that vision.
Me too. And it's what gives me hope,
Me too.
even in the face of so much pain and suffering.
Yeah, it can be overwhelming,
It can.
but there's also so much courage,
There is.
resilience, compassion.
It's inspiring.
It is.
And it's what keeps me going.
Me too. Those stories of resilience, those acts of kindness.
The people who are fighting for change,
The advocates, the healers.
they remind us that change is possible,
It is possible.
and we have to celebrate those small victories,
Wait,
those moments of healing
those connections,
that remind us why we do this work.
they fuel us.
It's about holding on to hope, even when things feel dark,
Even when it's hard,
because hope is what fuels our work,
it fuels our activism.
our commitment to a better world.
I love that. Holding on to hope.
Yeah, it sustains us.
It guides us.
It inspires us.
It does.
This conversation has been so inspiring.
It has been a pleasure
It really has.
talking with you.
It's challenged me to think more deeply about all of this.
I'm so glad to hear that.
So before we wrap up,
Yeah.
I want to acknowledge the weight of this topic.
It is heavy.
We've been talking about trauma,
Injustice.
systemic issues,
It can be a lot.
and it can be triggering for some people.
It can.
So if you're feeling overwhelmed,
Yeah.
please reach out for support.
There are resources out there.
There are.
You don't have to go through this alone.
We'll include some resources in the show notes.
That's a great idea.
And remember, seeking help is a sign of strength,
It is.
not weakness.
Not at all.
And there is hope
There is.
for healing, even from the deepest wounds.
Healing is possible.
It is. It's a journey worth taking.
It is.
It feels like we've just scratched the surface here.
I know, right?
There's so much more to this.
So much more to explore.
And that's why this conversation needs to keep going.
yeah, it can't stop here.
Not just in healthcare settings,
No, not
Yeah.
just there.
but everywhere.
In our communities, schools, workplaces, even our homes.
Right. Everywhere.
We need to be more aware of how trauma works.
Yeah, how it can look different in different cultures.
Exactly. And how our own biases can get in the way.
That's a good point. Our own biases.
They can really blind us.
It's like we've been given this new lens to see the world through.
Ooh, I like that.
One that helps us see what we didn't see before.
The unseen, the unspoken.
Yeah, exactly.
It's all about cultural humility.
That's right.
Recognizing we don't know everything.
Yeah, and being open to learning.
Open to new ideas, new perspectives.
And recognizing that healing isn't a one-size-fits-all thing.
Absolutely not.
What works for one person might not work for another.
And we got to be open to that.
Yeah, open to different approaches, different perspectives.
Especially from cultures that haven't always been heard.
Right. Cultures that have been marginalized, silenced.
We need to listen to those voices.
We need to decolonize our ideas about healing.
Yes, absolutely.
Recognize the wisdom that's already there.
In cultures that have been healing for centuries.
Yeah, centuries of knowledge.
And we're just starting to tap into that.
It's exciting.
It is.
So as we wrap up this deep dive,
Yeah.
what's the one message you want our listener to take away?
One message.
What do you want them to remember?
I want them to remember that we all have a role to play
Okay,
in creating a world where everyone can heal.
everyone.
It doesn't matter if you're a healthcare provider,
Right.
an educator, a policymaker.
We're just a person in a community
Yeah, we can all contribute.
to a culture of compassion,
Compassion.
Understanding. and support.
Yes, support for everyone.
And it starts with listening,
Listening.
learning, challenging our own assumptions,
Our own biases.
Yeah.
Being open to new ideas.
new ways of seeing the world.
And speaking up for those who need it.
Right. Advocating for the marginalized.
Making sure their voices are heard.
This has been so insightful.
It's been great talking to you.
Thank you for sharing your expertise with us.
My pleasure.
And to our listener, thank you for being here.
Yeah, thanks for joining us.
We hope this conversation has inspired you
To keep learning.
to keep exploring these ideas.
The intersections of culture, trauma, and healing.
Remember, healing is possible
It is.
for everyone.
Everyone.
And we all have a role to play in making that happen.
We do.
That's it for this deep dive. Thanks for listening.